I was going to also segue into Ben Greenfield, and I know you work with a lot of athletes.
Yep.
And I think we have some athletes among us here. But so tell us a little bit about the work that you did with Ben Greenfield.
Sure. Ben, obviously he's a friend of mine, and he really does a lot of great stuff in terms of he's a peak athlete, and he really is super interested in the supplementation and an expert in a lot of these things. And so he wanted to try out this procedure called what I call APS-C, or on the slides it was called V-cell, the very small embryonic stem cells. And we did that in combination with exosomes. And so, Ben's telomeres are 20 years old, so and yeah.
How old is he chronologically?
He's probably in his mid to later 30s, so
Wow.
he's operating at a very high efficient level.
Okay.
And he's an athlete, he eats right, he has his own supplement company, so everything from there that he produces is amazing. So when you do all these right things, but he's done like so many Ironmans too. So he's a super hardcore athlete, and so for him, what's the next level? So the next level is really kind of going into the cellular rejuvenation component, but then also doing the things where you know what cells to combine with what other growth factors. So that's what I did with Ben, and I've worked with UFC and PGA also, and so these are kind of the realms that for what I can talk about, they're very interested in these peak performance things because it's really just about helping the body become better. Right? It's not like blood doping. People ask me, is that blood doping? That's not really the same thing at all. Blood doping is a totally different phenomenon where you're trying to just have more capacity to exercise or perform. This is actually just about recovery.
Okay, and this is not banned, right? So for
not yet.
Not yet. Okay, so for masters athletes, like I'm 40, and they say that people over 40 and they're doing a lot of like gymnastic movements are going to naturally get what's called slap tears, which are little tears in your shoulders. Can stem cells repair that?
Yeah, I've treated a lot of people with either shoulder injuries, knee injuries, back. A lot of back patients usually are what I call they failed surgery. They have hardware, they have effusion, or the pain just doesn't go away with traditional medicine. So usually I'll use stem cells, and a lot of times people say, "Oh, I want you to grow back a new disc." Well, that's not really there right now. What stem cells I can say for back pain can do, maybe it can reduce the inflammation, it can help reduce the scar tissue in the area. So if you actually kind of approach it even from that, scar tissue and inflammation is kind of half the reason why we have pain, right? So that's why I say like stem cell therapy is just a third of the puzzle, but then it's also knowing what part of the puzzle are you treating. Are you treating the pain? Are you treating the inflammation? Are you treating the scar tissue? Are you treating the body's ability to heal? Are you addressing the guy's sleep? Is he eating foods that are really bad for him and then, or her, and it's causing inflammation? So you really have to approach it pretty comprehensively. And that's kind of why I kind of get two types of patients. I get my athletes and peak performers, or I get my really, really sick people who find me. Okay. It's usually that spectrum. And then more and more people are kind of in the middle where they're healthy, but they're thinking maybe I could get more sleep. If we didn't even have this conversation about sleep, most people don't even think that their sleep's bad. But then when you start driving into it, they start realizing, and why wouldn't you want to fix that? That's a third of your life.
Right, absolutely. How many of you use a Oura Ring or any kind of sleep tracker? Very small percentage, okay. But I guess we recommend it, right? As biohackers?
Yeah, even a Fitbit's great. Fitbit and Oura Ring are very close. Okay. Oura Ring, there's like a 2-month wait list. Fitbit's like Amazon now.
Wait, but Fitbit does the HRV?
Not so much, but I think in terms of just getting the data, it's pretty solid.
Okay. Great.
Oura Ring, that's O-U-R-A. Yeah.
Do you have a special code you want to?
I do. I'll post it online for you.
Okay, sounds good.
Just the Fitbit tracker. Just normal ones work really well, and I like it. It's super practical, and you can go in online and you can share it with your friends. Your scores.
There's also the Whoop band, right? You use the Whoop band because you're active.
Yeah, I think Whoop's more for athletes. You know, they kind of even set up your profiles like, what kind of athlete are you? I'm like, well, I live in New York. I'm that type of athlete.
Yeah.
Specifically for sleep, it's better to have a
Oura Ring, technically, I think. That's all they primarily do is the sleep. But I think Fitbit's just a really great overall, general tool. It does. I think Fitbit gives you about 85% of everything at a very easy entry point, and it's super customizable, like the style, the band. Oura Ring I think is definitely a very specialty item, and then again it's kind of a 2-month wait list right now.
Yeah,
but it's awesome.
It's worth the wait.
Yeah, it is.